So I'm going over an examination of a patient who has a labral tear. Now, a labral tear can occur acutely or chronically. So if it was acute, it would be the patient would fall in a pothole, step in a pothole, and it happens that way. Or chronically, it'd be more of a degeneration thing, where they do a lot of weight bearing, internal and external rotation at the hip. So it'd be more degenerative. And the pain is described as a localized groin pain, but it's a dull pain. It's not sharp or anything. And it can radiate to their butt or their lateral aspect of the hip. And pain occurs with prolonged activity and prolonged sitting. So if Fig here was sitting for a while, he'd have pain if he had a labral tear. And they would describe a clicking or catching feeling when I would ask them, all these, this is what I would conclude after my history questions. But and pain would increase with activity. And when I asked Fig to go through a range of motions, he would have pain through flexion, so it brings his hip up. So he'd have pain at the end of flexion, not in the beginning. The beginning would be fine, and then right when he gets to the top of it, that's when it would hurt. And then with internal rotation of the hip, that's external, internal, right at the end, same thing. And adduction, he'd have pain. Now some tests I could do, if you lay down. I could do the hip scoring test. So I'd be applying a downward pressure onto his joint, and I'll be just turning the hip into internal rotation and external rotation. And I could do an impingement test. Get that pain there. Or I could also do the Faber's test, where I'm applying pressure there, and that would have some pain. When I palpate, stand up real quick. There would be pain on the anterior aspect of the joint capsule in there, where the labrum is. And when I observe his gait, he'd have a shorted stride just because of the flexion, the pain in flexion. So when he goes to stride, it wouldn't be as long because of the range of motion. And the treatment, they'd say, is rest is a big part. But a lot of times after you do a week or two of rest, once you'll start feeling better. But once activities resume, if there's pain again, the only really thing is surgery. And so with neurological, if you have a labral tear, you could lose feeling with your dermatomes in L1, L2, and L3. But so those are really just neurological. That could happen if you have a labral tear.